This is lab 19 on the dog specimen. So today we're finishing up the terminal aorta. So we're looking at arteries to start with. So for orientation last time we did the deep circumflex iliacs here. And then we also did the caudal mesenteric artery here. So now we're continuing down to where you see all of these branches coming off. So these are what we're looking at today. We have here in the forceps on the left side is the left external iliac artery. Here on the right side, elevated by the probe, is the right external iliac. So the external iliacs will then continue out into the hind limbs. They'll pass through the vascular lacuna and become the femoral arteries. Next we have the internal iliac here in the forceps on the left side. Here, elevated by the probe on the right side. So left and right internal iliac arteries. And then the final terminal branch here is just a single branch instead of a paired one, and it's the median sacral artery here. Okay, so today we're going to follow the internal iliac on the left side here. So internal iliac, and usually right away, gives off this umbilical artery that kind of looks like a nerve, may not look like an artery, but that's the umbilical artery. And it is going to kind of flip around here and go to the bladder. So if I can pick up the bladder here. So here we'll push this over and elevate the bladder a little bit. So this right here is the bladder, and you can see here we pick up that umbilical artery again. Looks kind of like a nerve. I can't even pick it up. There we go. So right here, and just kind of swooping around going to that bladder. That's umbilical artery. Then we're going to kind of push everything out of the way here, make a little hole, and so we're looking at the continuation then of that internal iliac right here. So internal iliac, here where the probe is, and then you'll have a small branch, which will be the internal pudendal artery, and then you have a really large branch, and that is the caudal gluteal artery. So caudal gluteal we will dissect in a subsequent lab, not right now, and the internal pudendal is what we're going to focus on today. So here is the internal pudendal artery, and you'll follow that into this pelvic cavity here. And you'll have it split again here. So here's internal pudendal. Here's the split. So you'll have internal pudendal that will continue. And in the dog it goes outside of the pelvic cavity, and we'll look at that in just a minute. But here, and this is a female, so we're going to have all the female terms on this dog. So this is a vaginal artery coming off. In the male it would be a prostatic, but here in a female it's a vaginal artery. And then the vaginal artery will then give off several branches, as you can see here. So this one is going caudally and up towards the rectum here. So this is going to be the middle rectal coming off. And then we'll have a branch going towards the bladder again, which is this caudal vesical artery. And then we'll have a little bit bigger branch that kind of dives down. It likes to hide down there. And this is the uterine artery. So here, we'll follow it through, put my forceps kind of around it, and we'll flip the uterus, flip the body wall so we can see the uterus right here. And so here you see my forceps there, and that is that uterine artery coming out and going along this left side, the left uterine horn. So uterine artery there. Okay. Now we'll go back to that continuation. So here was that vaginal coming off. And here is that continuation of internal pudendal going outside the pelvis. So now we're going to flip the leg and take a look at where that goes. So you're digging, if you can follow it on the left side, I would recommend doing that. If you don't have this visible or they're broken, you'll have to skin out this portion on the right side of your animal and just skin that ischiorectal fossa here to take a look at these vessels. So internal pudendal emerges outside the pelvis here as it comes out. And you follow it along here, and you'll have a lot of nerves here too in the way. But here it's that internal pudendal. Then it's going to branch here as you see. So here is going to be a ventral perineal branch, and then you are going to have the artery of the clitoris. So here we'll follow the artery of the clitoris that goes deep down here. So all along here, artery of the clitoris. Then this little ventral perineal artery here then gives off this caudal rectal right here in the forceps, and then we'll continue as a ventral perineal, just going to that perineal region. So going down here. So ventral perineal here, artery of the clitoris there. Okay, then we'll move on to the bladder. So I will flip the leg over again. And here we'll go back to where we saw the bladder. And I'm just going to kind of push it through so we can see it a little bit. So there's the bladder. And when you're inside the body wall, it's just this little bubble here. And we'll look at the ligaments. So one we already looked at was the median ligament of the bladder, which is right here. But it also has lateral ligaments on either side. So here would be a lateral ligament on this side, and here would be a lateral ligament on the right side. And they're usually kind of filled with fat, but those are the lateral ligaments of the bladder. So lateral, median is here, and then we'll go back to the other side where you can see my cut. You're going to make a cut ventrally into your bladder. I'll just flip all that up here. So I've made the cut through the ventral side of my bladder and down into the urethra. So you'll want to do that. And once you open that up, what you're looking for then is where the ureters come in. So here would be where a ureter comes in. Here's where the other ureter would come in. And so those openings, along with the opening into the urethra, form a triangular area called the trigone of the bladder. So right there is the trigone of the bladder. Then we have the urethra here. And you can see it's kind of covered in that brownish striated muscle. So that's the urethral muscle or urethralis muscle right here, covering that urethra. All right, and then we have the rectum. So we'll go back here inside the body wall and see our descending colon right here. We have descending colon, and as that descending colon goes into the pelvic inlet right here where my finger is, that then changes to be the rectum. So rectum goes into the pelvis. And here you can see this would be the rectum here inside the pelvis. So here is that rectum. And then we'll move from rectum into what's called the anal canal. So here, if you make a dorsal incision, you can open this up a little bit, and you'll see that anal canal. So the anus is the external opening, and the anal canal is just this little area that is the transition between rectum and the anus. So here we have the columnar zone. You can see kind of these folds in the mucosa here. So that's columnar zone in there. Then we have the anocutaneous line, which would be right where the probe is here. So that's the transition then between that columnar zone and this cutaneous zone. So here's cutaneous zone. It has these little hairs, and it also will have the openings to the anal sac. So here's one opening to the anal sac, and the other one right here. So little holes that you'll see that go into the anal sacs. Okay, so here on the outer side, the lateral side, you're looking for a muscle that goes around the anus. So here we have the external anal sphincter. So right here is the external anal sphincter. So once you've identified that, you just want to make a cut and kind of lift it up. And underneath you should be able to identify the perianal sinus or anal sac right here. And then if you want to, you can try and lift that up. And underneath that anal sac, you'll see this smooth muscle right here. It's kind of hard to see and not very distinct, but this is the internal anal sphincter. So right there would be that smooth muscle, internal anal sphincter. And here we have that nicely striated and defined external anal sphincter. Okay. Then we have the rectococcygeus muscle that we just go dorsal to the rectum here, dorsal to the anal column here. And you'll be looking for a single midline muscle that's going from the tail to that rectum. So you just kind of have to dig in there, and it's kind of a different color, so that's going to be a smooth muscle also. But here is that rectococcygeus muscle, right there. All right, then we'll move on to the female anatomy parts that we have to do on this dog. So here is the uterus. We've already covered that. Here would be the uterine body, and then here, right here, would be the cervix, so that enlargement here. And we are going to take a look at a picture in the textbook so I can show you the different parts that are on your list for terms. So here, for orientation, this would be the cervix we were just looking at. It would be right here, this enlargement. So you want to look for the external ostium. So external uterine ostium would be the entrance to get into the cervical canal from the vagina. So that would be right here. And then the internal uterine ostium would be here, going into the body of the uterus on the other side. So this cervical canal is the pathway to get into the uterus here. Then also shown on this picture, so your vagina is here, and this would be the fornix. This little piece that kind of dips under that cervix would be the fornix of the vagina. All right, so the vagina extends from the cervix all the way down. So from the cervix to the vestibule, and that is marked. We can actually see that part on our dog here. So here we opened up the vulva with a dorsal cut, and so you want to do that. So then the vestibule is this space here, and then the vulva is the outer layer. So that's going to have the labia. So you have labia on either side, and those come together ventrally at the ventral commissure, and here I have cut the dorsal commissure of the labia here. So right here would be dorsal commissure, ventral commissure, and the labia. So that area is the vulva. And here in your vestibule, if I lift this up a little bit, here we go. So this is the fossa clitoridis right here, this space where the probe is. So that's the fossa, and down in the fossa would be the clitoris. All right, so then we go back up to our urethral tubercle, and you'll have the opening to the urethra. And I just want to show some of the things that the male has that the female did not in the other parts. So here, we're in the right side on the ischiorectal fossa. So I just want to show you the continuation of that internal pudendal artery coming out. And that will branch into those two branches that we saw, the ventral perineal here, and that gives off a caudal rectal. And then you have the nice big branch that you see here, the artery of the penis in the male. So here I've cut the right side on the crus here. So the right crus has been cut, and I'm going to pull that down. And hopefully you can see this continuation going down of the artery of the penis. And here you have three branches that we need to name. This first branch coming off right here, if I can maybe elevate it with the probe, there, that first branch is going to be the artery of the bulb of the penis. Then you have another artery coming off just next to it, and that will be the deep artery of the penis right there. Then this third piece that continues down will then be the dorsal artery of the penis. So we're just going to flip the dog a little bit, and I just want to show you that dorsal artery of the penis. So here we do have the penis here. It's been taken out of the prepuce, and here's that dorsal artery of the penis. It loses its injection at this point, but this is on the right side. So it just continues right along here, down the penis. Okay. So now we're going to flip all of this over and take a look at some of the male parts that we didn't do before. So here we're in that pelvic cavity again. And here, this big bump that you see is the prostate. And so here is my bladder that's been opened right here. And so the urethra begins here, and you have a pelvic part of the urethra. So that will be between the probe and the forceps here, and so that's within the pelvis. And then the pelvic part of the urethra then has a prostatic part, so that's inside the prostate. So here you can see the urethra goes right through the prostate here. And then we have a post-prostatic part of the urethra here. It's still in the pelvis, so it's still part of the pelvic part of urethra. And that part, the post-prostatic, is covered by this urethralis muscle. So you can see these striations here. And that's urethralis muscle covering the urethra there. Then the penile urethra then extends down in the penis all the way down. Okay. Then we'll move on to the penis itself. We have regional terms that we need to name for the penis. So we have the root of the penis will be here. So this part would be root. And then we have the body, so from there to there. And then we have the free part. So it's going to be here. And the free part is within the prepuce. So here the prepuce has been cut open, but that just enclosed like that. And so prepuce, the preputial orifice, is the opening. And here I've cut from the opening all the way back to what's called the fornix. And that's just where the prepuce then goes back onto the penis. So it's kind of this little stopping point right here. So this would be the fornix. And then we have retractor penis muscle that we need to look at. So that's a ventral midline structure here. So that's going to be right here. So retractor penis muscle, right there. And then we'll move back up towards the root of the penis and kind of go over some of these parts. So here on the left side, so this is left side of the dog. So everything is kind of uncovered on the left side of the penis here. So this would be the left crus, and this is where it anchors to the pelvis. So this part was cut away from the pelvis, but this is the left crus, and the crus is made up of the corpus cavernosum erectile tissue, which I'll just outline with the probe right here. So that's an erectile tissue, and then the tunica albuginea is the white surrounding that. And then that is all covered on the outside by the ischiocavernosus muscle. So that's this kind of V-shaped muscle right here. So that makes up the crus, and this is the left side. You also have a right crus, so there are two total. Then in between the crura, so in between left crus and right crus, you will have this muscle, the bulbospongiosus muscle, kind of fibers going across here. And so that's bulbospongiosus muscle, and bulbospongiosus muscle covers corpus spongiosum erectile tissue. So here if I pull back on the crus and I've cut a section into the bulb, what's called the bulb of the penis. So this erectile tissue is corpus spongiosum erectile tissue. And you have, in the bulb, there's two sides to that, but we'll see in a minute that it's just one continuing down the penis. So we'll see that in just a minute. But this would be the bulb area that I've cut here, and that's in between the crura. And then we'll move down to another section here. So I've cut kind of a transverse section across, and this is just in that body of the penis. And here we'll look at the corpus cavernosum. So corpus cavernosum remains paired all the way down here, so that's corpus cavernosum. The white parts are the tunica albuginea. And then here, I'll stick the probe in the urethra. So the urethra is the little hole in the middle here, ventrally. And then you have the corpus spongiosum. There isn't a lot of it here to look at, but it's surrounding that urethra. So right there would be corpus spongiosum, urethra, corpus cavernosum. Okay, then we'll move down into the glands. So here I've made a dorsal incision in the penis. And if you open that up, the glans has the pars bulbus glandis, so that's here, pars bulbus glandis, there. And then as you move down towards the tip, you'll have the pars longa glandis. So that will be right here, here on the cut edge. So pars longa glandis. Then if you palpate right here, so in between my thumb and my other thumb, would be the os penis. So you can palpate that. It's a bone in the penis, but you do have one in your bone box to take a look at, so you want to see that. Then on the ventral side of that, so down under here where the bone is, inside the bone is a groove. It's called the urethral groove, and that's where the urethra travels through the bone. So one additional term in the prostate, so we're back at the prostate here, and I've opened it up. And here, if I can hold this open, maybe I'll just hold it open with my fingers. There we go. So this bump right in the middle, so right here, just right there, and then will be the colliculus seminalis here, and that should be it for the male stuff on Lab 19.